the cue. All right, are we ready? Are we ready for some patient monitoring procedures with Dr. Ben Moralia? Dr. Moralia is going to come up, and of course you remember him from yesterday. And today his topic is patient monitoring procedures. If you'd like to take it away.
Yeah, thank you. I'm back. Look out, my apologies. All right, here we go. So the monitoring, the monitoring procedures, this is very nice. So this is the stuff that's happening outside of your office. This is what the patient does every 2 weeks. They take their little scan and they're given guidance. Move on to your aligner, wear it an extra week. So all of this stuff is outside of what you're doing in your practice after you started the case. But meanwhile, you should know a fair amount about it so you know what's behind the scenes in kind of going on behind the big curtain. Meanwhile, this is the key. This is the key to freeing up your chair time and that column. Those of you doing aligners have that column. You got your doctor column, and you're doing your restorative dentistry, and then you got your aligner column, and all of a sudden you got your aligner checks all day long going on. That is the non-revenue column. It's painful. We got to get that column out of your schedule. So here is the pathway to get that out of your schedule. So what is monitoring? Okay, so it's like a 2-minute video. It's going to describe the monitoring and how things are going. So I'll let this play for a moment as the intro, and then we'll talk through some slides and some information.
We understand your goal, to achieve a beautiful smile within the expected time frame, or even earlier. Here's how we can help. You know, traditionally, clear aligner treatments rely solely on in-person visits. If your treatment progresses faster than expected, we won't know until your next visit. If there's an issue during your treatment, we'll catch it at the next appointment, and that sets back your progress. So your overall treatment timeline may be extended. Are you busy or traveling? Rescheduling visits also adds extra time to your treatment. With only in-person visits, it can take longer to achieve that beautiful smile. This is why we offer you Pro Monitoring, a smart technology to help us monitor your treatment progress remotely. Take your scans from anywhere, and we'll keep everything on track. This way, your doctor knows exactly what's happening with your treatment and how you are progressing, and we can schedule your office visits at the right time. If your treatment progresses faster than expected, we will know right away and you will be ready to move ahead. If there's an issue during your treatment, it will be detected promptly without wasting precious time. Busy or traveling? No problem. You can use Pro Monitoring anywhere and at any time. It's easy. The Pro Monitoring app will notify you when it's time to scan. Just follow the instructions. Pro Monitoring has helped thousands of people complete their treatments with fewer delays. But remember, it only works if you regularly take the scans as requested. Experience a quicker path to your perfect smile with Pro Monitoring.
All right, here we go. So the difference between the left and right. Now the left side of the screen is what's going on in your office with your aligner system currently. The conventional in-office monitoring is your eyeballs. And your eyeballs, you have to have the patient in the chair, they wear their aligner, they come in, oh, hello, you're here for your aligner check, let's see how they look, oh, try the next one on. You look wonderful, let's give you 3 more. And in your office, you might be handing out 2 aligners, or 3 aligners, or 4 aligners. And so whatever you're giving out, the patient will walk in at the interval. So let's say 3 aligners would be 6 weeks. So every 6 weeks, they're in your chair for you to look and say, well, that looks good, so here's more. So you give them more. So the routine aligner check appointments are necessary. So they're coming to see you. Patient has to travel. They got to come to you and then go home. So that's their time. The lost chair time, well, this says late show-ups, cancels, reschedules. That's an issue, but never mind that. Before we get to that type of stuff, it's just having the non-revenue column. Just having a non-revenue aligner column is not profitable. And so we're going to build this out through these slides so you can see, wow, that's really costing me to do it this way. Clinical oversight and records collected at every aligner visit. No, you can't do that. It would be physically impossible and counterproductive when your patient were to come in at a 3 aligner check if you took a set of photographs and a scan. If you had to take a set of photos and a scan at every single aligner check, Now you would need an amount of time with a full assistant in that visit to run that visit. So you could imagine what it would cost you to take a full set of records during each aligner check. So that's an impossibility. Meanwhile, if we look at what remote monitoring does, driven by the AI that's happening from their smartphone at home away from you, the routine aligner check appointments are gone. There are none. So you do not need the non-revenue column. What you can do is you can have your patient come at whatever interval you might be comfortable with, and I'll give you some guidance on that in a second. The patient travel requirements are gone. They no longer need to come to see you every X number of weeks that you're on a pattern of doing. You don't have late shows, cancels, reschedules when you're only seeing the patient 2 or 3 times across the whole year, but meaning this is the least amount of importance right there. The most important part is you don't have a column. You no longer have to have a column of those non-revenue aligner checks. And that could be a couple of patients when you're starting out, but the moment your volume starts ramping up and now you're doing 50, 60, 100 cases a year, you know what that column's gonna look like? You could have 50 or 60 patients in that column at an interval along the way, because next thing you know, you have all of these patients in the middle of treatment and you're growing more because it's becoming more popular and it's unavoidable. People like their aligners, they want to have it, so you would be doing lots of cases, having this full column that's just a weight on you. The clinical oversight and records at every visit, absolutely, because at every aligner, every 2 weeks, the patient will take a digital scan with their phone of the aligners in and out. So in and out, and it's amazing what the AI can pull from the phone. That little tube they put their lips around and move the aligner, move their phone back and forth, up and down, open and closed, aligners in, aligners out. This whole process takes like 30 seconds. But in that 30 seconds, all of the data collected is equivalent to a full set of records. So all of a sudden, you do have a full set of records at every 2-week mark. At every single aligner, you will have a full set of records. So the difference is tremendous. Now, on the left side of the screen, the conventional monitoring, we remember what that led to. I started the whole process off yesterday with that slide, your journey. Consider your journey. Have you had 23 aligners and then 18? Have you worn 18 and get 23 back? Are you on a second, third, or fourth round? Do you have a posterior open mite? It won't close. If you're living in that world, remember how that world came about. It was you checking the aligners every 3, 4, 5 times, whatever it was. If you're checking them 3 aligners, 4 aligners, 5 aligners, they came in, you said it looked okay, you gave them more. But then at the end, oh my God, I need another round, I need another round, I need another round. I still have a posterior open mite. So the eyeballs don't quite cut it. So it's amazing how that left side of the column, we're living in pain, and on the right side, we don't have to have this pain. It's a big pain point to remove. How does the monitoring work? Well, basically, we are using AI. So now the AI, but the AI was trained by real doctors. So this comes from the largest volume of material in dental monitoring is put together, and it's FDA cleared. So this is an FDA cleared dental monitoring company, and sure enough, the detection is regarding the teeth, the hygiene, and gum disease. So it turns out in the gum disease category, it's equivalent to an in-office exam. The AI is so good, it's equivalent to an in-office exam. So we get to do this, prescribe the protocol. Number one, you get to choose. You have choices. It's not just automatically running. You do have choices if you want to vary some things. How many days in the aligner? We have choices, 7 and 14. We'll talk about that a little bit when we get to those choices. Predominantly, I do a 14, but I'll give you some examples of why it would be different. Then, of course, what are we looking for? Well, the tracking issues can be found, the compliance issues can be found, and of course, oral hygiene can be monitored. Because if you're going to let your patient go for 6 months or 12 months, we're GPs, so it wouldn't really be 12 unless they're out-of-towners. So generally, what we have is a model where the patient does get seen in the hygiene chair. So in our office, we're going to go with a 6-month hygiene visit as the predominance. Every now and then it's a 4 or 3, you know your patients. Well, if they're having a 6-month hygiene visit, we start treatment. That's one visit, we start treatment. We will have a treatment visit to end treatment, but the checks are only in hygiene chair. So the check is 6 months. So we do a 6-month interval, but that 6-month interval is a hygiene visit. Now your hygiene appointment is a revenue-producing appointment. So your patient is coming in on a 6-month interval in the hygiene chair, revenue producing. With the revenue producing hygiene visit, you get to have your 2-minute aligner check. Oh, you're 6 months into treatment. Now meanwhile, the scans are taken, they're 2-week intervals. Every scan, you already know from the portal, my patient's on track perfectly. The AI says they are. So now you know, hey, I'm on track and I have no extra appointments. So we treat our patients with only 2 visits and the hygiene appointment. And that's how you remove that column. You do not want that column in your schedule. Now, Pro monitoring, it's evaluating the teeth from multiple angles at every aligner and it's with and without the aligners. So the digital treatment plan that was made to move your teeth, basically we were talking about yesterday how we're going to move all the teeth. You saw all the teeth moving. We moved all the teeth. So every 2 weeks, the teeth are in a different spot. Every 2 weeks, the teeth are in a different spot. Now you've got that digital model that built the movement. Now you're taking your scan. So you have your aligners on, so you have a scan with them on, you have a scan with them off. Well, the AI can put that all together and tell you, after 2 weeks, did every single movement get accomplished that was supposed to in those 2 weeks? And the end result is either a yes or a no. If it's yes, you move on. If it's a no, you're going to wear that aligner one more week. So we are evaluating every tooth, every angle that can be received from that movement, and it shows you how to move it around to get it all. And you're doing it every 2 weeks with your aligners in and out. All that information is processed by the AI, way better than our eyeballs are doing. All right, deviations. If your patient does a little something different, everybody gets a message. They get a message, you get a message. In other words, if your patient, let's say, scans too soon or is scanning too late, well, we know it's supposed to be a 2-week interval. So if they scan something too soon, everybody gets a message. Wait, they scanned it 10 days instead of 14. Somebody's on the wrong day. Or if 14 days go by and they didn't scan, everybody gets a message. The patient gets an alert at 14, scan. But if a 15th or 16th day goes by, you get a note. Your patient forgot to scan yesterday. You could generate a note to go to them. You can tell your team, give them a ring. But all of this can be done automated, and it's all easy because you get it on an email. It'll come in the office email. You just forward it to the patient. You can click and send. You basically have a connection to them through all this technology. Now, everything here gets updated automatically. It is all uploaded into your portal. So everything the patient does on their own at home, 2-week intervals, is all put in the portal. So you're using clear aligners, you know you have a doctor portal. You open it up, you see your patients there, right? You got a list of patients. Some of them you're just starting, so you're sending in the scans and photos. Then some of them are at the treatment stage where, hey, I'm looking at the video, I'm getting ready to approve. Then you got patients in treatment, so patients are in treatment. The moment you start treatment, the portal has a whole section, pro monitoring. Now the monitoring section is every scan. And with every scan comes all the information with it. And every 2 weeks it's added and added and added. And it just builds out the scans right through treatment. So all of it is there to see. And you basically have 100% control of the oversight. So while you're behind the scenes and it's all happening outside of your hands, it's set up so that you have total control over it. And you can schedule your regular office visits if you like. So I'm comfortable enough now that we just do the hygiene chair visits. That's all you need. Now, if you decided that, okay, that's a little too far of a stretch, I don't want to go 6 months, I know it's in the portal, I can check it there, you could say at the beginning, maybe for a couple of cases, for your comfort level, you might have them come in 3 months between their hygiene visits. So you'd only add 1 check. So between hygiene visits, if you want them to come in 3 months later, pop in at 3 months, you can take a look, gain some confidence and comfort knowing that this is going to go well, even if you don't see your patient. And then sure enough, at some point you will get rid of those visits because you're not going to want those visits, especially when you can see the tracking on the computer that they're doing well. All right, so now, here's some of this nice research on AI and how effective it is for dentistry. So first of all, it's HIPAA compliant. So as far as data privacy goes, all of this AI is HIPAA compliant. The image quality, because your patients are using their own smartphone. So a smartphone, whether it's Android or iPhone, the smartphones are accurate to use as clinical records. So anything that is taken on a smartphone can be submitted as dental, medical, clinical records. That's how accurate the images are. Tooth movement. Your smartphone is accurate to pull tooth movement information off of, and of course that's the whole point, is to monitor tooth movement. So we know the accuracy is good for tooth movement, but it's also good for hygiene. And in fact, the AI can perform as a human eye can in an office for hygiene, equivalent to a visual exam by a human dentist. In other words, the AI accuracy on gingival hygiene is as good as human eyes in a clinical setting doing a visual examination. So we are now equal to a computer. All right. Now, predictability. At the end of treatment, when the doctor and the patient agree the treatment is finished, well, the AI also knows that. And so it works either way. If the AI thinks it's done, the human and the patient and the doctor would agree. If the doctor and patient think it's done, the AI will know. So you have the two corresponding. A finish can be approved either way. If you decide it's good enough, great. If the AI decides it's good enough, you can look in there and you'll probably be agreeing. The AI is good enough to know you're done. So we have the AI helping us with the finished quality. And then it's the efficiency, the significantly decreasing the office visits. This is the key to it. So you are getting the most amount of oversight. So it's not less oversight, it's the most amount of oversight you could possibly have while you're treating a patient but meanwhile, the least number of chair time visits. And what that is for us is really, you're eliminating the non-revenue appointments. You need to eliminate the non-revenue appointments. Okay, so all those are out there. So from the patient perspective, what's happening on the patient end? On the patient end of this, we got to get started, right? First, you have to get started. This is the default setting that we have in there. The default setting is that this automatically activates the patient's account when the aligner kit is delivered. So when the aligner kit gets shipped, obviously it's tracked, so the delivery of the aligners, the delivery triggers the automatic activation of the patient account. So the monitoring is ready to roll the moment the aligners get delivered. That's our automatic default. The other choice is to manually activate it, which I'll show you. You can annually activate a start monitoring process. I just leave it on automatically. So now basically the monitoring is engaged the day the aligners get delivered. And here we go. Here's another way that this can happen through the app. So the aligner kit comes, and the first thing you see when you open the box is that card. And there's your scan code. So the QR code is for the patient to go with their phone, and instantly the app gets installed. Step one, it'll install the app on their phone. And then step two, there's an activate button right on there. So now the activate link in the email comes, they click that, and this is all automatic. So the moment they scan the QR code, within a minute, you are now active and ready to go. And it will ask you to take your first scan. Put your aligner in, take your first scan. So this is as smooth and easy as could be. Now the box that gets delivered, we should talk about that for a minute, because you do have two choices. If you're going to do an attachment or two, if you have a little IPR, well, you know you have to do this in the office. So that box needs to arrive at your office so the patient can come in. Maybe you put an attachment or two on, maybe you're going to do a little IPR, and then you have to start this at your office. What if you didn't have any attachments and you don't have any IPR to do? You know where that box can go, right? Right to their doorstep. So I'm 4 years in, and of course I wanted to see this whole thing happen, so the first few patients, this would come to the office, and we would get started. They would scan the code, they would put their aligner in, we'd talk instructions, we'd send them home with the whole box. But once I saw that happen 2 or 3 times, I didn't need to do that anymore. So we send it to their house. So basically the patient comes in, we know we're doing aligners. When we order this, I click ship to the home address. I don't have attachments and I don't have IPR. That box shows up on their doorstep, but I see it on my end in my portal. The day it arrives, I get a notification. The aligners are on their doorstep. And of course, they open the box and there's the scan code. We've already told them. The first thing you do when you open the box is get your phone out and scan that, and it walks them through. Here's the app, there's your email, activate it, take your first scan. Put your aligner in, take a scan. It's very easy. You will that day get a notification. Your patient took their first scan. Now you know they're off and running. We'll make a phone call. The day they get it and we see that it happened, it landed on their doorstep and they activated their thing, we call them up and we say, hey, we saw your aligners got arrived, we saw you put the first one in, we saw you took a scan. Congratulations, you're off to the races. The other phone call is, hey, we know your aligners got delivered, and we see that you have not scanned your first scan yet, so we're just making sure that you got it off your front porch, you took it in out of the weather, and you put the first, so you just make sure that they got started. So one of the 2 phone calls is happening, and that's just a couple of minutes. Now, the manual option, let's just say you didn't, or you changed the automatic activation. Manually, you can go into the doctor portal, your patient's right there, and on the left side, there's one way to do it. There's 2 different ways to activate this thing. Send an activation email. It's one of the brightest tabs right on there. So when you go to your patient, Mrs. Smith is getting her aligners. You can go, Mrs. Smith, when you open it, right on the thing, the top icon in blue right there is resend the activation email. When you click that, your patient automatically gets a new email saying, hey, it's time to activate your account, and you take your first scan. So that's a manual way. The other way is you can go into the monitoring portal, because you've got your doctor portal, and attached to that is the monitoring portal. So the monitoring portal, side by side, you're looking at this, you can click it there. You have 2 different ways to click send an activation email to your patient so they know, oh, it's in my phone, I'm reminded to take my first scan. Pretty smooth. The manual activation, when you do that, the patient gets an email. Oh, hi, Jeff, welcome to remote monitoring. And there it is. 2-step process. Step 1, download the app. You have a link right there in the email. And then step 2, click on the activation link, and now you're ready to go. The next thing will be to take your first scan. So aligner 1, day 1 is called a baseline scan. So the app includes the instructions. The app also has the simple tutorial videos. How to clean your cheek retractor tube. How to scan with the ScanPro box. How to set up your ScanBox Pro, meaning it is 2 parts. You do have to connect a tube to a cylinder. So it's on the counter out there. You can see how difficult that is to connect those 2 parts. It's 2 Legos that only go together one way. So Yeah. But we have a video on that. That's how clean this system is. There's a video on how to connect two parts that only go together one way. So takes care of it all. So now basically the first scan, you put your aligners in and you do scan on day one. You scan on day one because this is your baseline scan, and it's sophisticated enough, the AI knows that's not a match. So day one, the scan is a red mark because the teeth and the aligners don't match, right? Your teeth are going to be where the aligner is in 2 weeks. So even though your aligner is on, it went on all the way, that is not where your teeth will be in 2 weeks. So it knows on day one, that is not a match. You get a red mark. And 2 weeks later when you scan, if you've worn your aligner well, it should be a green mark. So you get a red mark first. It's very sophisticated to know the fraction of a movement in the first aligner is not accomplished on day one, so you get a red mark. Okay, so now you've got this first scan taken. It's very easy. This is what it looks like. Let's see if this will go. You get the tube connected, put your smartphone in, and you look in a mirror. She's looking in a mirror. And you just follow in the mirror. The yellow circles turn green when you have a correct view. So I'll play that one more time. I know it's a little glare. Let me go back one and see if it'll do one more time. The little circles are yellow at first. So they're yellow on the screen. And when you slide across, they turn green. You can see the yellow turn green. So as you're moving along, you get a green change, so it's successful. It knows it has the right view. It's got all the data it needs, and it lets you move on. And if it doesn't, you just slide back and forth. It's very easy. Then it'll tell you on the screen, it'll tell you tip it down, tip it up. It'll tell you when to open your mouth, when to close your mouth. It'll tell you to take your aligners out and repeat it. So basically, you're going to do a full scan, aligners in and out, left, right, up and down, and then aligners out, left, right, up and down. Once you've done this once, it is a 30-second scan. It takes 30 seconds to do this whole thing, and all you do is look in the mirror, and it tells you exactly, there's an arrow, tells you go to your right, okay, go to your left. And the dots turn color. Very simple. It's beautiful, this system. So now, generally we're going to talk about 2-week scans. We're going to go a 2-week scan. So the patient will receive a notification because they have the app in their phone, of course. And on the mark, because they've taken their first scan, it automatically sets up. 2 weeks later, they get the little notification. Just like you get notifications all day long for things you like or have. Everybody has notifications for something. Whether it's pick up the kid, drop off the kid, go to the gym, do this, do that. We've all got notifications, right? My flight is at this time. So all these notifications, well, one of them will be your aligner scan. So you get, oh, there it is. And that morning you wake up and see oh, today's scan day. It's 14 days. So all of a sudden they get the reminder, and then they're going to have to take a scan. So now, when the patient gets the reminder after 2 weeks, they will take a scan. And they will hit the button on the thing, scan day, take my scan. Once you take the scan and you've successfully yellow dot to green dot, you've done all the things, it'll check mark, it'll go right to the end and say, you got a successful scan, done. And the next tab on the right, send it. Once you've secured the scan, then you send it. So the patient does a 30-second scan, it confirms you got all the parts in there, right? Great, send the scan. That scan now goes into the AI to give them a response. So one of two things will happen. Your patient has taken a 2-week scan. They're going to be told, advance to the next aligner. Congratulations, you get to move on. And it even says which one, because now this, I know the screen says 2 to 3. Obviously, we put the first one in. We did 2 weeks. It would be 1 to 2. So you would just move on to the next aligner. If you take that scan and the AI recognizes that you did not accomplish all of the tooth movement during those 2 weeks, it will tell you wear it another week. So it'll say stay in the current aligner, scan in 7 days. So it automatically puts the notification now in 7 days to remind you. You're going to wear that aligner. It'll remind you, okay, look, 22 hours a day. Do a nice job for 1 week. If you want to put the chewy in there and bite on it a little bit, you can. I don't use the chewies, but I guess you could try that. 7 days later, they're going to scan. They'll get their notification. They will scan in 7 days. And in 7 days, if they've done a little better job, then the AI will tell them to move on. So this has been going on for years now, so we can tell you by statistical analysis, most scans result in a 2-week move on. Then there's a small percentage of scans that result in wear it an extra week. And then there's a fraction of a percent where you have to wear it another week, meaning a 4th week. That happens occasionally. And if it does, the patient is just guided, wear it another week and scan until it's successful. Basically, you're not allowed to move on until the movement was accomplished. And now when the movement is accomplished, you're in a good spot. When you miss a bit of a movement on a tooth, it only gets compounded from that aligner to the end. There's very little catch-up going on when you just change your aligners all the way through. And if you just do 2-week wear all the way through, you might actually be looking at an aligner that fits your patient. Remember aligner 23? It looked okay, it's in their mouth. But when you scan and send it back, you got another treatment plan with 18 more. So there's a disconnect. There's a disconnect between what's happening under that aligner and if it's really done or not. The AI is better than our eyes. So on the clinician side of things, right, the patient side of things, this is all automatic. Updates, notifications in their phone, they just keep taking their scan, they move along. On the clinician side of it, basically, we can take a look at where we were. Okay, before the monitoring, we're having limited clinical oversight with whatever we decide. And I'm just putting here an example, 3 aligners. 3 aligners is a pace, you're handing them out, you say come back in 6 weeks, right? 2 weeks each. And 3 aligners, you could be doing 2, 4, 6, it doesn't matter the number. I'm just throwing 3, you do your own, you figure out how many visits am I using for this patient. But if I give out 3 aligners and the patient comes back in 6 weeks and I do 3 at a time throughout the treatment, what if my patient had 24 aligners? Now on the first day I could give out 3, and I'm giving 3 at a time to get to 24. Well, that's 8 times 3 is 24. So I need 7 more visits to make it to 8, and now I've got 7 visits in between the 2 on the ends. That's a lot of chair time. Okay, here we go. Multiply times the number of patients you're treating. So that's not working well for me because I'm getting lots of extra aligners and rounds of treatment. I can't seem to get the case done. Something's lost. So we don't really know what's happening, but it is possible that your aligner could look like it's all the way down and the tracking underneath is not really happening very well. The only obvious one is if the aligner won't go on. If you put the aligner and it won't go on by a couple of millimeters and all you see is air in there, well, that's a real big misfit. That doesn't fit all of the teeth. When you see a gap of air, that's not fitting anything. But the reality is your aligner can be forced down because that scalloped edge has so much flexibility and distortion that as the weeks are going by, you can fit it onto the teeth, but they're not following along. So you can get to the last aligner and have a misfit enough that you get another 18 aligners, right? So that's what's going on. So now we'll shift to the monitoring. Let the monitoring tell us if every single tooth movement's been expressed and are we really cooking along here. So we'll talk about the difference between 7 and 14 days. So I use 7 in a very limited fashion, but I'll tell you when they are so you have an opportunity to try this. Traditionally, I do 14-day changes. I think it's beautiful. It's healthy for the teeth, the gum, and the bone. There's no reason to accelerate this. The time frames on treatment were shown yesterday in some of those cases. I showed you nice time frames, and it didn't take that long to make these nice changes, so why are we rushing? I like 14 days. It helps me stay in a beautiful treatment pattern that I'm very used to. Now, when do I use 7 days? So I do a lot of refinement. So I would say almost all of the cases. And so I can tell you why. I'm in this over 20 years and I've done a fair amount of publishing. And in order to publish a case, it has to go through a peer review board because reputable journal articles do not want to publish garbage. And so they will reject your case if it doesn't look like a beautiful thing that they would want to publish in their journal. So I'm accustomed to going through peer review journal boards to get my cases published. And to this day, I have not been rejected yet. So I do not have an example of submitting orthodontic cases to peer review boards and getting rejected saying it's not the quality we would publish in our journal. I'm not looking for that letter. So what I do is I will use all the aligners for my patient. I will take the photos and the scan. I can tell you honestly, my patient would probably be very happy if I said, here are your retainers, you're done. I could do that on most of the cases. I could say, look, that looks amazing, I'm happy, you're happy, let's get retainers. However, I take the photos, I take the scan, and I tell them, look, let me show you the scan. I look at all the views and I say, I could make an improvement. I know you just wore 24 aligners, but would you be willing to wear 4 more, maybe 5? Because I would like to improve, and I'll just show them. If I were to just do a slight adjustment here, it is a little bit better. We're in this far, why don't we go for perfect, right? And I can tell my patient honestly, if I were to publish this case, if I make the few extra aligners, I could probably pass a review board that would say it's worthy of publication. That's a nice place to be. I enjoy that. Then the patient says, yeah, we've come this far, I would do that. So I'm happy to make a few more, and I do that for almost all the cases. It's very rare for me to say, you're done, here's your retainer. I will take the photos, take the scan, be very picky, and tell my patient, I'm going to make you a few more. So that's very common for me. So since that's common for me, and they're going to get a few more, we wore 24, we're getting 5 more, let's say 5 more, that's where they wear them 1 week each. The little adjustment I'm making is just for something particular so that it looks amazing if it shows up in a journal article. I can pass a peer review board, and anybody across anywhere that opens that and reads it would say, that's a really nice result. I don't know who this guy is, but he made a nice treatment here. That's a wonderful job, right? Instead of getting an email saying, I saw your case, that doesn't look so good. So I like the 7-day change in the refinement. So 1 week. So if I do 24 aligners 2 weeks each and then I get 5 more from my patient, that's 5 weeks later they're done. 5 weeks, they can wear those for 5. That's a wonderful opportunity to test that out. The other category would be very mild treatment, mild case. I can give you the example. It's a younger person, 20 to 30. They had braces, they didn't wear their retainer, but 20 to 30, they just have a little relapse. It's just a slight change, right? But it's upsetting to them, and they want to fix it. If you're young and you had braces and your teeth are close, they haven't really fully collapsed, you need a little bit of adjustment, you could do 7 days. You could do that case with 7 days from the start. You're going to make them maybe 8 or 10 aligners total. You're doing a slight correction from their lack of wearing their retainer. They're young, they heal faster, so the category of younger, slight relapse, short case, that checks all the boxes for doing 7-day change. Now the beauty of this system is that when you do 7-day change for that patient, you'll just click the button 7 in their chart. You go in their portal and you switch, the 14 is a default. You'll just switch it to 7. You'll click the 7-day change. The notification in their phone says 7 days. Guess what happens in 7 days when they scan? If it's good, they move on. If it's not, they wear it the extra week. So let's say I make 10 aligners for somebody for a mild case. They might be able to do 7 days for the whole time. But just in case there was one aligner that didn't get it done in 7 days, I have the AI let me know they should wear that 14 days. So they might have in 10 aligners an aligner or 2 where they'll go 14 days. And the AI tells them, so I have a wonderful opportunity to use 7 days for mild cases. And you do too, so there's nothing wrong with trying that out, and you'll love it. The best place to try it is in the refinement stage. When you've done most of the work and you're just tweaking something a little bit for perfection, let them wear them 1 week each then. That's a quick way to finish the case, okay? So 14 days are going to go by. When they scan and the aligners seat properly, the AI determines it's all been accomplished appropriately. Here's what happens. They get a go-ahead. And if it doesn't seat properly, they will wear it for 7 more days. Now, automatically, when the AI says, yep, wear it 1 more week, it has the notification built in to remind them. 7 days later, they get their notification. They will take a new scan and, again, most of the time move on. But what happens if they get 3 consecutive no-goes? Well, you wore it 2 weeks. You got a no-go. 3 weeks, you got a no-go. 4 weeks, you got a no-go. You're up to 5 weeks. When you get your 3 consecutive no-goes, now the clinician intervention is triggered. Now the first thing that happens is the notification goes to our orthodontist on staff that has been monitoring this behind the scenes. So the one who set up the treatment plan now reviews the whole treatment. The orthodontist reviews the whole treatment up to this point and sees that, hey, we've gotten these 3 no-goes in a row. Why did we get that? They figure it out. And then they decide in these 3 choices here on the right. You can stay for 1 more week. If they believe 1 more week will get them a good spot, they'll do that. Recommend staying and doing 1 more week. Proceed. If the orthodontist behind the scenes looks at that 5 weeks of wear, checks the whole history of the case and decides we're better off moving on, something is wrong that isn't about the wear time, we're just going to move to the next aligner because we will test 1 aligner forward. And most of the time when you proceed and scan again in 2 weeks, you have the green, you're back on track. So there is a tiny possibility that you can wear an aligner and the AI will not like it, but you'll be okay in the next one. So proceed is a very common choice. An office visit is last, because if that orthodontist behind the scenes looks at this and says, oh yeah, there's air everywhere, something really went off the base here, then you got to get to the office. So you get an email. So you get a notification now. So the orthodontist behind the scenes reviews this, they make their best choice, and they send it to you for approval. So I would get an email. Dr. Moralia, Mrs. Smith has sent in the scan, but we've done these 5 weeks here. We're up to 3 no-goes. I've reviewed this. I believe proceeding to the next aligner is a good choice. Well, I'll open my portal. I'll take a look also. I've had this happen a couple of times. So in 4 years now, a couple of times you get an email. I go in there, I look, and since they recommend to proceed, all right, who am I to override that? Let me just proceed. Let them go to the next aligner. So because this happens once in a while, I let the patient go to the next aligner, and you know what I'm doing then? We have a little notification about 2 weeks later to make sure it's green. Because 2 weeks later of wearing their next aligner, they're green, they're back on track. So the couple of times this has happened to me where they wore 5 weeks with not being able to go, we moved to the next aligner, 2 weeks later they're back on track with a green recording. So I'm happy to agree. I haven't had to do an in-office visit yet. So I'm 4 years in, I haven't had the issue where the orthodontist behind the scenes took a look at this and said, you know, after 5 weeks I can see this is a real big problem, you better get to the office. If they did recommend that, I'd say, yeah, call the patient, have them come over, because obviously there's something big going on. We haven't had that issue yet. I've gone ahead and proceeded. I haven't done the stay another week. So after the 3 no-goes, we're up to 5 weeks, I haven't chosen stay a longer. Let's go another week in the aligner. I don't think that's going to be helpful. I like the proceed tab. So far that's gone well. We're talking about 2 or 3 times in the last 4 years. It doesn't happen that often that a patient wears an aligner for 5 weeks and can't move on. But once in a while, you're going to have that happen. Now, what are you seeing on your dashboard? Because as the clinician, you open up your doctor portal. You got your portal, you got all your cases there, all your patients, you can select a patient, you go in their chart. This is putting their scans together. So on the top bar is the tracking. So 1, 2, 3, 4, 5, 6, 7, oh, number 14. You can see at number 14, the red box is a no-go. So 14 had 2 no-goes before they had, oops, yep. I can see it here. Okay, everybody on the stage. All right, so 14, you can see 14 has 2 red squares. That's 2 no-goes. So 14 became a 4-week aligner before they moved on. So at number 14, which they're up to, is where they got the go-ahead after having 2 no-goes. So you had to wear that for 4 weeks to get the recording. That was nice. Now the tracking is the first one. That's the scanning, letting them move on. The second line, it has a toothbrush. It's the hygiene. And a green dot means that the gum tissue and the plaque levels are good. Your gum looks good. It's not inflamed. There's no red or bleeding, not puffy inflamed gums, and no plaque accumulation around there. The AI is very sensitive. It's very sensitive to plaque. So I do not teach my patients about this hygiene monitoring. I let them find out the hard way. So I like it. I like it a lot. So now we're going to see them in 6 months. They're going to come in the hygiene chair, and it's very fun because, you know, in 6 months' time, there's a really good chance that you're going to have a patient eat a meal, okay? Have a meal or something, put their aligners back in without a thorough cleaning, but then realize, oh, it's scan day, and they're going to scan after eating, putting their aligners back on, and it's going to pick up all that plaque along the teeth. So they immediately get a notification that says, because they might get the go-ahead, green, congratulations, move on to your next aligner. But the next line says, however, we need you to increase your oral hygiene. And so now it does in a very professional way about increasing the oral hygiene to reduce the plaque levels because we're picking up a little plaque. Meanwhile, it's food stuck around there because they did, right? So your patient walks in and says it a different way, and it says, yeah, you know, your app told me I don't brush my teeth. Your app told me I'm not brushing my teeth right, and then I got plaque all over my mouth, and they right away they get defensive, and they say, it's because I had just eaten and I took the scan. It doesn't know I brush my teeth 3 times a day. I'm trying to tell this app I'm brushing 3 times a day, I'm flossing twice a day, I've got a water flosser that your hygienist gave me, and now I got a pick I have to use everywhere, and this thing's telling me I don't have good oral hygiene, so it's a fun time. Then they come back and they do all this, because they're trying to be good hygiene and defending, and then they get that scan, and now the scan is in your computer. So you can bring it up, and you bring it on scan and say, oh yeah, look at that. You just ate like a Big Mac, didn't you? Like it's all in there. Was that wings? Was that wings? What do you got in there? So then you can have a little fun with that. No, it looks like nachos. You were having nachos. So whatever you want to do with your patients, the ones who have a sense of humor. Right? Yeah, you make sure you know the difference there. You got patients that have a sense of humor, and then you have patients who don't have a sense of humor. So play with the ones who do. Make it fun. Make it a fun day. That's a good time. The compliance is just about, are they scanning on time? The compliance isn't, did they wear the right hours? That's not that. It's, are they scanning on the right time? So the green dots mean, yeah, this patient scanned on the 2-week mark, like on the 2-week mark. Because if they're missing their scan and scanning after, whatever, 17 days or 20 days, it marks a red dot, meaning they're not scanning on time. And so then you know you're not scanning on time. There could be a delay in treatment. If they take 3 weeks to scan something because they forgot, meanwhile, you get a notification. There's no forgetting. You get a notification. But some patients just, the time goes by and they miss a scan. All right. The selector is every single scan they take along the way. So as they take scans, they're stitched together. So it goes right through the dates. So you can see here, this is a March through August time frame. So we're talking about 3 to 8. So we got, what was that, 5 months. There's like 5 months of time there. And then you can see, you can bring up each one individually and you can look at it. That's how it looks at the beginning. And of course, this is where we are at August. So very nice that we're moving along with the case. And you're getting this in your portal. So you get to have that in your portal. So you're welcome to open it and see every 2 weeks the patients. You can always peek in there and say, oh, wow, how's it looking? In the beginning, it's interesting because you're like, all right, well, they're away from us. We're not going to see them in 6 months. Maybe we should just take a peek in there. And you can open it up and see your active patients and just take a peek. And after a while, you get so comfortable, you stop looking at it because you know if they get a no-go, it's going to come as a notification to the office. So your team will open their email one morning and say, oh, yeah, look at that. We got a no-go for someone. Maybe we should take a peek. And you take a peek. The AI handles all the steps. You're kind of just watching in the background. It's really nice. Now, eliminating the routine office visits is wonderful because what you're doing is you're taking away that non-revenue column. We got to get rid of the non-revenue column, keep them in the hygiene chair, wonderful. And then, of course, the improved compliance comes from your patient knows they have to get permission to move on. Your patient automatically knows on the first day, I'm going to be taking a scan in 2 weeks that lets me go to the next aligner. It's automatically now spinning in their head that I probably should keep these in as much as possible because your patient really doesn't want to take a scan and get a rejection. And the red mark that says you have to wear it another week. That's like getting a big failure. So, if I built it, I would smack a big letter F on it. Bang. So your phone would have the biggest letter F and be like, you failure, you big failure. Look what you did. Look what you did for 2 weeks. A disaster. You're a disgrace. Absolute disgrace. But not all these patients are my teenagers, so I can't do that. All right. Monitoring. This is a study. This was Dr. Duncan did this. It's down in the bottom corner, his name, Dr. Grant Duncan. This is very nice. He did this for 100 patients, okay, and then 80 in the pro monitoring group. So basically what we have here is this control group, conventional treatment. He's going to give out aligners on an interval, and you'll see here the appointments and stuff. And then the experimental group was the monitoring where we just were doing two visits, start and finish. Okay. So the doctor appointments for the control group, 7.2. So we were looking at, let's say, 24 aligners, a first visit, a last visit. If you're doing 3 aligners at a time, you're coming in every 3 aligners for 24. You got 8 visits, right? Well, 7 visits for the control group, average for 100 patients. Your team appointments turn out to be 10.5 appointments that are in there for your team, right? The hours. Refinements, 91%. So when he did that 100 where he was delivering the aligners on an interval and having them check, 91 out of 100 patients got a refinement. And then, of course, that's 9 out of 100 didn't. Okay, the duration of treatment, an average of 17 months to do this. And of course, the treatment includes the aligners plus the refinement. So 91% of these cases are going longer, so that counts in your time. Now this group here, 2.1 visits, because we're trying to do it in 2 visits, but you'll see why the 2.1, because as we move down, the refinement is 13.9, so 14% are refined. So 14 refined means they need another visit, because when you come in on your second visit, if you're not done, you get a scan, there is a third visit. So 14% have a third visit, the majority have 2 visits, you average it out, you're about 2.1. Your team appointments, your team time is down to 4.4, and all of a sudden the duration is 10. So look at the difference, it's significant. The percentages are significant. And what it means is if you can treat successfully in 2 visits, you do lose the non-revenue chair time column. There's no reason for that chair time column. And look at the opportunity here. All right, pretty nice. We're going to cover one more case now. So one more case, and what I'm going to do here is take you one step past yesterday. Yesterday we looked at aligner alone, and aligner alone is very capable. We showed you very nice technique. Transverse measurement, we looked at developing arch expansion, doing little to no IPR. Well, yesterday with me was little to none. And what we're doing is now going to show you a case that aligners plus. So every now and then you meet people who need aligners plus something else, and maybe there's a reason for it. So we'll take a look at Lauren. We meet Lauren, and when she first comes in, she looks like this. So that is a picture of an unhealthy teenager. She's struggling in a lot of different directions. And she has a diagnosis. So at age 14 and a half, we have a medical history. And of course, in your office, you have a medical history and a dental history form. So you do collect all this information. You're learning about your patients. Well, it turns out she has obstructive sleep apnea, insomnia, narcolepsy, anxiety, depression, headaches, asthma, TMD. She also has ADHD, which is not on that list. She has and is medicated for ADHD. It's not in the list there for some reason. Okay, here she is smiling. Those are straight front teeth. She has straight front teeth because at 14 and a half, Lauren, did you have braces as a teenager? Now we know she did because she's wearing a lingual bonded bar, but we said, did you have braces? Yep, 2 years. So from 12 to 14, she had braces for 2 years, so her front teeth are straight. And that's how they look. Straight front teeth. And the back teeth go straight back. So we're thinking we're narrow, but we don't know yet. We're gonna know in a minute. So we've had 2 years of braces to get here, and now we're taking some records, and then there's this picture. Look at that picture. Now don't say anything out loud. So we're going to back up a step. So this picture can be very deceiving. It looks like straight teeth. It looks like a nice bite, actually. However, there's no room for somebody, is there? So take a look at that picture, and let me say, before anybody misspeaks by accident, Lauren, like every other human being I've ever met, has the right size tongue. Her tongue is absolutely normal size. Absolutely normal size. To have perspective, now we want to think about, where do you think that tongue goes when she closes her mouth? It can only go one way, backwards, right? Her tongue can't come forward. It can't go to the sides. That's your wall of teeth. So the wall of teeth are the prison that your tongue is living in, and there's only one exit, backwards. So if you take this picture going forward and you start recognizing, oh, I think there's a little less room for that tongue, it might correspond to some of the things you might be screening for in the medical history. So all of a sudden we recognize there's no room, and if you look at the sides, does it show on the screen or is it a little bit off? She already has scalloping. So I'm looking at the monitor here, which is a little better image than the screen. She already has scalloping on the borders, and scalloped tongue is already a risk factor for OSA. So we're 14.5, but she has the diagnosis from a sleep study. So we're looking in there and we're seeing that. And of course, we could have her lift her tongue up a little bit to see maybe there's a lingual frenum that's a touch tighter, because a tongue tie does exist. That's not a mythical creature. A tongue tie is a real thing. Some people have it. Their tongue is a little restricted. It does attach to the ridge, so it comes to the ridge. There's a little restriction in the tongue. A little restriction in the tongue is associated with less jaw development. Less jaw development is directly associated with sleep disorder breathing or OSA. So these two things are directly connected. All right, maybe there's a little bit of a frenum restriction. But then there's this picture. Yesterday I taught you about transverse measurement, and I told you what healthy, stable, good occlusions land 35 to 39 millimeters by the age of 12. So a 12-year-old would achieve a 35 to 39 millimeter transverse measurement. So now you know her number, 29. 29. Now to put that into perspective, I'll teach you the previous research, because yesterday we were talking about adults and we may as well have the full numbers so you have perspective on the whole thing. Dr. Bogue did the research before Dr. McNamara about 90 to 120 years ago, where he did all the research on the primary dentition to predict the adult dentition. Because you know what happens when you see baby teeth that are together and there's no space, right? Baby teeth that are together and no space means, oh, the permanent teeth will be crowded. Well, you know this, the dental community knows, if I don't have spacing in the baby teeth, I'm going to have crowded permanent teeth. That's Dr. Bogue's research. You just might not remember his name. But Dr. Bogue knew the measurements that you needed in the baby teeth to develop good occlusion. And it turns out a 4-year-old needs to have 30 millimeters between A and J. So a 4-year-old has to be 30 millimeters between A and J in order to have mixed dentition come in appropriately and not need orthodontic care when you're 12. So the human being who is developing well at age 4 will measure 30 millimeters. Does that give you some perspective on Lauren at 14? She's 29 at 14. So her 3 and 14 are 29 millimeters apart, and that is an unacceptable number for a 4-year-old. It should be no surprise she's struggling with that list downstream. She can't breathe. Now with this measurement, her tongue has no room, but with this measurement comes the high vault. Look at that vault. The roof of your mouth is also the floor of your nose. Your maxilla also builds the lateral walls of your nasal chamber. So the interesting thing is that if your maxilla is narrow, it's also vaulted. So what you're looking at, that high vault, my thumbs will be the vault, my fingers will be the lateral walls of your nasal chamber. When you're looking at an underdeveloped maxilla, you're looking at this. So the thumbs pop up, that's the vault you see inside, and the fingers come together because your maxilla are the sides of your nasal chamber. When you go back to the office and you look at the skull again, the maxilla makes up 1/3 of your orbit, and it makes up the lateral chamber, lateral walls of your nasal cavity, and it makes up the floor of the nasal cavity. She can't breathe through her nose, and her tongue is in the back of her throat. She can't get the air behind her tongue. Can't breathe through her nose, can't get the air behind her tongue. Those are two big problems. It's no surprise she has a long list. When did the list begin? As a 3-year-old, she couldn't sleep through the night. So to take the full history, she slept 2 hours at a time. That's how you get to an insomnia diagnosis, because when you sleep 2 hours at a time, you're up all night. When you're up all night, you could qualify as an insomniac. Then, of course, narcolepsy is you can't stay awake at school, so you fall asleep every single day, multiple times at school, but then there's a test for narcolepsy, which we'll get to next. These are all confirmed medical diagnoses, not descriptions that the patient tells you and you make up a name for it. 29 millimeters, that's a bad number, but she did have braces, so her front teeth are straight. There's the bar, keep those straight. We don't want those to relapse, right? Because if those front teeth relapse, that'll really be a big problem for her. She has no other problems, right? So she can't breathe, but we'll keep those teeth straight. All right. She did have a pediatric polysomnograph. Her numbers are horrific. If you know numbers and you're in this space, you know already. But 65 as an RDI and AHI of 47, these are really bad numbers. A child only needs to have 1 incident per hour to qualify as an obstructive sleep apnea patient. 1. She's at 9.3 and 6.7 per hour. She's 6 and 9 times the rate it takes to just be diagnosed as OSA for a kid. That's a bad number. Mild to moderate OSA, elevated indices, restless sleep, snoring, and of course the daytime sleepiness needs to be, possibility of narcolepsy. But it turns out there's a test for narcolepsy. It's called the multiple sleep latency test. In a 30-minute time period, you're given a chance to take a nap. Patient lays down. If they can fall asleep in more than half, so you're given 4 chances. If you fall asleep in 3 out of 4 and you reach REM in 3 out of 4, you qualify as a narcoleptic. Lauren had 4 chances to nap. She fell asleep in all 4 in an average of 9 minutes. This is in the middle of the day. 4 nap chances, falls asleep in 9 minutes, but in 3 of the 4 naps, she enters REM. Now, you're not supposed to enter REM in 10 minutes. You go through stage 1, stage 2, stage 3, stage 4, you come back to REM, you enter REM a long time later, not 9 or 10 minutes. So now, she falls asleep all 4 times, she enters REM in 3 out of 4. So now, of course, what's happening is you have a diagnosis. This is how you get a narcolepsy diagnosis, not because you told someone I fell asleep at school. She's narcoleptic. Letters have to go to the school. Once again, in assessment, Lauren has at least 1, in all likelihood, 2 distinct organic sleep disturbances accounting for her. Here it is. Excessive daytime sleepiness, occasional poor school performance, latenesses, and absences. This letter comes from the pediatric pulmonologist. I write one also because now we're entering collaborative care. What we're trying to do for a 14-and-a-half-year-old who's a freshman in high school is give her more time because she's not a substandard student. She just cannot perform given the fact that she can't sleep at night. And it's going on 11 years. It's 11 years. She's never slept through the night. 14-and-a-half years old, never slept through the night. At 4 years old, she had such digestive issues. By age 6, she had endoscopies done. A 6-year-old getting endoscopies because they didn't know what was going on with her digestive system. So now the school's giving her more time for everything, testing, the projects, you name it. She can't function at school. So what are we going to do for Lauren? I told you Aligners Plus. So this is a little bit beyond, but it's out there, and you may as well see a little extra because why not? We're going to go with fixed expanders first. We have a foundational problem, so we're going to address the foundation first, teeth second. So foundational becomes expanders. We're going to use expanders, upper and lower, to grow the jaws. Growing the upper jaw gives me back my nasal chamber. Growing the lower jaw gives me back my tongue space. Then once I do that, I've got the right foundation, I will need to coordinate the teeth. Because her teeth are lined up and straight, but I'm about to change the foundation. So let's change the foundation, give her the foundation she needs, then go back and address the teeth. So the first half of this is 9 months of fixed expanders. The second half is 12 months of aligners. So the second stage will be the aligners. This is an Aligners Plus case. Because if she's a freshman in high school, and I'm going to put her through 9 months of expanders, which are inside, nobody really sees, when those come off and we go into phase 2, she'll be a sophomore in high school. But usually sophomores in high school are done with braces. So you don't want to be the only kid in high school with braces on at sophomore year, so we're going to go to clear aligners. Plus, braces are bad for you. She's already had them. We saw the results. Didn't help her one bit, did it? Fixed expanders for 9 months, change this to this. Now, you've got the upper and lower. I'm going to tell you in a moment the numbers, but it's a significant difference. So let's look at the upper only first. This is upper and lower after fixed expanders for 9 months. Here's the upper change. Now you can see the difference, 29 to 38. Thank you. 29 to 38 is 9 millimeters of bone growth because this is much bigger. However, look at the vault. Look at the vault now. Yeah, so when you get that beautiful expansion going, the vault will rotate all the way down. And now, when you're doing beautiful expansion, what's happening is that triangle that we had, because this was her nasal chamber inside, that's your maxilla framing out the nasal chamber, is now this. Because when you do appropriate expansion, the lateral walls of the nasal chamber are going to separate. And the vault will come all the way down. Now she has this. So what that should translate to in her world is, I can breathe through my nose now. And once someone can breathe through their nose, and when you see the lower is this big too, and your tongue has room, I can breathe through my nose and my tongue has room, you know what you do? You sleep through the night. So waking up every 2 hours over this 9 months becomes sleeping 3 hours at a time, 4 hours at a time, 5, 6, 7. By the time we're done in 9 months, she sleeps through the night. First time in her life. Now guess what happens when you sleep through the night? You start to heal. Here comes the lower change. We did 9 millimeters on top, you got to do 9 millimeters on the bottom. You can't do 9 millimeters on top and nothing on the bottom. Your tongue doesn't have the room yet. So an upper-only expander is a terrible choice. We do the upper and lower expansion, and this is what you'll see from the front view. And again, the fixed expanders are only for 9 months, and they've only addressed the bone. We haven't done anything to the teeth. That's why they look a little bit awkward. We're about to coordinate the teeth next. That's what the aligners are for. 9 months of fixed expanders, foundational growth, we're good there. Then you got to do your 12 months of aligners to coordinate those teeth at a whole new width. But if we jump in and she's 38 millimeters wide, when we put aligners in there, we want more. We're going to go to 41, 3 more, push her to 41, because after the 9 months, her symptom list is reducing, but it's not gone. Maybe her tongue needs a little more room. We go bigger. We're going to go wider. But here she is after 9 months. Now, 9 months later, we've only used the expanders, but you can see in her eyes. Take a good look at her eyes. Yeah. So on the right side of the screen, the child on the right has a bigger maxilla and a bigger mandible. She has more tongue space. She can breathe through her nose. So all of a sudden, on the right side of the screen, that kid's sleeping through the night, starting to heal. We're getting better. But look at the difference in the smile. And all you've done is fixed expanders. We haven't done anything to her teeth yet. Nothing. This is not tooth focused yet. The teeth are next. So now we've got this beautiful setup. The foundation is right. She looks amazing, and we haven't done anything to the teeth yet. I'm about to coordinate those next. That's a bigger upper jaw. That's a bigger lower jaw. Then we got to take the expanders out, scanner for the aligners. We'll send them in, obviously, to you-know-who. And then, of course, I'm going to make her in-office vacuum form retainer, because it takes 3 weeks to make the aligners. You cannot leave my office with nothing, because things will relapse. So we make in-office vacuum form. She wears a vacuum form for 3 weeks while the new aligners come. Yeah, the tongue tie was a little bit there. We would call mild, but so was the lip tie mild. So she goes to a myofunctional therapist. That's on the list. Myofunctional therapist determines, yep, we're going to do some exercises and we're going to get those released. The release was Dr. Scott Siegel in Manhattan. After the aligners, we'll get clear retainers to wear to bed. But let's see what happens after the part 2, the clear aligners. All right, here, phase 2. Now, the first picture on the left is after the expanders, but now we're going to put aligners on her for 12 months. And that 12 months of aligners is 10 plus 2. So 10 months, 20 aligners, then a few more. It was 20 and 4 or 5, so we're going to do 12 months of aligners, but we'll take her from 38 to 41. You're still going wider. There is no narrower or backwards. You're always going wider and forward, so we make her wider, 41. The lower has to follow that. Now the lower is beautifully placed out here and aligned after the expander to after the aligners, okay? So now we have our picture on the left, which is after the expander. She started to heal. We're sophomore year of high school, but this happens to be fast forward 2 years. That's her senior year picture, September of senior year. September of senior year, she has absolutely no symptoms, no medications. I'm going to go over that in a minute. We're going to look at the whole treatment. She started out at 29 millimeters and we brought her to 41. We did fixed expanders to give her the right size foundation. We gave her aligners to go ahead. It was 9 months plus 12 months. She had 2 years of braces to make her front teeth straight. 24 months in braces for straight front teeth with a list that she had struggled with for a decade. That's a tooth-focused approach. We delivered 9 months plus 12 months. You can do the math. It's less than 2 years of treatment to give her the right size foundation, breathing and sleeping back. The lower has to follow. There's the beginning picture before treatment, how narrow that is. Now that is opened up so wide, her tongue has the right space to live in. She doesn't get a lower bar anymore. Here's your before and after. The bone is bigger. I know the teeth are straight and you like to stare at the teeth, but you should focus on the maxilla and the mandible. Because when you do 9 millimeters of expansion like that, you're going to see your teeth, your gum line, and your alveolar bone just beautiful. So the bone is bigger for her, and then the teeth can be coordinated nicely. And of course, it's a different smile. But you have a different human being now, totally different human being. Post-treatment polysomnogram. Of course, you go back and you take a sleep study. They're all zeros here. These are all zeros now. Instead of having 6 times the rate to be pediatric OSA, or 9 times, you get your letter back from the doc. 16-year-old female with anxiety, depression, ADHD. There's the ADHD. I wasn't making stuff up. I know she has it. I didn't put it on the first slide. Who was diagnosed with moderate OSA, narcolepsy without cataplexy at Norwalk Hospital, has morning headaches, daytime somnolence. Patient used a CPAP previously. She was a CPAP failure. She tried CPAP. It failed because even with a CPAP, it wasn't enough pressure to get that air behind her tongue. 29 millimeters with your tongue wedged back, the CPAP can't force the air through there. She was a CPAP failure. Now she's post-tongue lip tie removal and palatal expander at age 15. So now the polysomnograph is ordered to reevaluate for possible OSA, followed by the multiple sleep latency test. The diagnosis, no significant OSA. Pediatric standards, meaning if she just had 1 event per hour, she'd be OSA still. So even though she's 16, they'll use the pediatric standard. That's very nice to not have OSA. How do you know you don't have narcolepsy? Well, you go in the sleep lab and you're given 4 opportunities to take a nap in 30 minutes. You can't fall asleep anymore during the day. You don't get to fall asleep during the day or need to fall asleep during the day when you sleep beautifully at night. So 4 times she can't fall asleep. If you can't fall asleep, you can't reach REM. She's no longer narcoleptic. When you sleep through the night, you're not an insomniac either. You get a little note. Hey, Dr. Morale, I hope all is well. Attached, please find the results from Lauren's recent sleep study. I also included her study from 3 years ago. Very interesting how she no longer presents with apnea or narcolepsy. It's wildly interesting, because what do you think I had to say at the consultation? I don't treat OSA, I don't treat insomnia, I don't treat narcolepsy, I don't treat ADHD, I don't treat anxiety, I don't treat depression, I don't treat asthma. I treat underdeveloped jaws. I'm a dentist, I treat malocclusion. I treat underdeveloped jaws. I taught them the numbers, I taught them where they are, and I said, this is what will improve you. We have to give you better breathing through your nose. We have to give you tongue space. You have a little bit of a tight frenum. We might need that released. Myofunctional therapy. We put together a whole comprehensive plan for this patient to improve her. It's a full heal, which is what we get to experience most of the time. Now today, Lauren's a sophomore in college. She is more than 3 years post-treatment. When we were finished, it was sophomore year, so junior, senior, freshman year. We'll say 3 full years later. She's 3 full years out of treatment, and she is no longer struggling with, suffering with, or medicated or treated for OSA, insomnia, narcolepsy, anxiety, depression, headaches, asthma, TMD, and the one missing from here is ADHD, which was in the medical note you saw. I should have had ADHD or 2, because you know ADHD comes with amphetamines. You know which ones on this list get medicated. A child like this with that list is on a cocktail of medications. Not anymore. We meet her here. This is senior year. You know, senior year, remember in school you had to make a science project board? Remember when we went to school and we made a science project board? Okay. So she comes in at the end of senior year to share this with us and says, hey, I'm going to come to your office. I got to show you this. It's like, okay, let's see what you got. So she sets it up. What she did for her senior year, she did a research. She likes the research. She did a research project. So comes in, sets it up. Dr. Morale, watch this. I found these flies. I found these flies. What they do is during the day, they're very active. So you get a clear cylinder, and they move in the cylinder. Now, the flies happen to be very rhythmical. They move around the cylinder very nicely. So they move around very nicely in the cylinder all day long. But then at night, this is a fly that's dormant at night. They freeze. So all of a sudden, at nighttime, they freeze. They don't move. During the day, they move. Then at night, they freeze. Okay, obviously, she studies that for enough time. We have it documented. Split the flies in half, 2 cylinders. And you know what she's going to do to that other group now, right? She's going to wake them up every 2 hours. She goes in the room, turns on the lights, and shakes the can. Turn on the lights and shake the can. Get them to move. Shut off the light. You disturb them for 15 minutes. Go back to bed. Every 2 hours. She wakes that fly group up every 2 hours. It took 7 days. 7 days later, that canister during the day, the control group has its rhythm of movement throughout the day, and they freeze at night. 7 days later, the other group is a tornado and a hurricane of flies in the can. They're nothing but chaos. There is no order. There is no rhythm. It is nothing but chaos in that can. It took a whole 7 days. The reason she did it was because this was me. I'm that chaos can. I was woken up every 2 hours because I couldn't breathe, I couldn't sleep, and the medical community treated me for over a decade without any resolution of anything. I've been suffering for 10 years because I couldn't breathe and sleep, and you're the only person who helped me. Okay, regional. New York State, regional for seniors. Senior Science Project, New York State, regional, first place. You advance to sectionals. Sectionals, first place. The state finals, she wins first place. So her science project is a first place winner for senior year at the New York State level. It's a very nice honor for her to share that with us. Guess what she's in college for? Research. You'll learn her whole name one day. Her name will be on papers published on this because that kid is as bright as could be. She just couldn't focus in school because she only slept 2 hours. Imagine how you would be working in your office. You only slept 2 hours at a time. Nightmare, right? All right, last step here is just to cover profitability, because now we want to talk about the difference between, yes, let me bring you right back down. It's New York paced, baby. We got to move. You want your lunch on time, right? All right, profitability. This is with the competitor. This might be the model you're working in right now. We're going to go with 8, 10, and 12 visits across the top. Take your picture because you can scribble in your own numbers when you get back home. I'm going with a $5,000 case fee just to do some math. It's about the math. You can fill in your own numbers. The competitor lab fee, I'm going with 18, but if you did the cost of it plus the retainers you get could be 300 too. You know, you might have to adjust the 18 depending upon the level you're at. But let's just go with the 8 visit mark. You have your patient coming in for 24 aligners. They're going to come in every 3 aligners. You're going to have 8 visits. Okay, $5,000 minus the 18, we're left with $3,200. $3,200 is not your profit. You have to figure out how many hours are you spending. Now, if you spend 2 hours treating that patient, total, 2 hours total, you can divide the $3,200 in half and you get $1,600 an hour. But what if you spent the third hour or a fourth hour? If you go to 4 hours over a year or two treating a patient, you're down to $800 an hour for your aligner treatment. Yeah, you might want to change over and do sealants instead. Because can't you do 16 sealants in 10 minutes? Do the math on sealants, trust me. It's very nice. I just want to be a sealant expert. I'm just trying to be a sealant expert. When I grow up, I want to be a sealant expert. Okay, so these numbers are horrific when you're looking at $800 an hour as your profit margin for doing an aligner case. These are horrific. This is what it means to have that non-revenue appointment in your calendar, okay? Now we're going to go to where you are going to be with Glidewell. You're going to have your $5,000. We're going to start with the 2-visit column. We'll move our way to 4. With 2 visits, a start and finish, that means 1 in the middle in your hygiene chair. Remember, the middle visit's going to be hygiene. We don't count it. It doesn't count. 2 visits is your treatment in your aligner chair, but now 1 visit in between could be hygiene chair. All right. Your lab bill, $12.99. What an attractive number that $12.99 is. Yep, stare at that a while. The revenue, $37.01. Look at the math I had to do for you. This is Saturday morning. This is Saturday morning math. $37.01. Look at that. I kept the 1 there. I didn't even average it evenly to be 3,700 to make it easy on myself. Chair time, I put 0.5. That's 30 minutes. You should not get to 30 minutes eventually, 1 step at a time. But if I spend 30 minutes of time treating an aligner case because they're only in my hygiene chair every 6 months, that 30 minutes, if I have $3,700 to work with, well, per hour, that's $7,402. My aligner profitability is $7,400 an hour when I'm at 30 minutes, so I don't get to 30 minutes. Now let's put you in the middle, 1 hour. I'm going to give you 1 hour as a goal. A very good goal for aligner treatment is to do 1 hour of time total. We'll say 4 visits because you're going to have your 2 at the ends, and we're going to have a hygiene check, and I'm going to let you have a 3-month check in between the 2 hygienes. You see how that works out to 4? You have a start, you have a finish. The hygiene visit doesn't count, but dead center is hygiene. We're going to go 3 months on either side of the hygiene visit. Okay, it's a 4-visit count. I'm giving you 30 minutes plus my 30 minutes, 1 hour. $12.99, $37.01 is the same. Oh, for 1 hour, look at the math, it's so easy in the middle column, it's $37.01. Your profitability when you invest 1 hour treating an aligner case is $3,700 an hour. That's a nice profit number. But even if you spilled to 1.5 hours, 90 minutes, that's going to be 6 visits. That's you seeing the patient every other month. If you saw them every other month, well, the hygiene chair won't count. The first and second are going to be 2. You'd end up with 4 extra visits. You're up to 6. 6 visits, maybe you get to 90 minutes. You're still $2,400 an hour. Your profitability is still 24. It's nothing like the other chart. Look at the disaster this chart is. That's a disaster. This chart here will tell you, if you plugged in your own numbers, you'd realize I'm not making money doing aligners. Maybe I should stick to crown and bridge and veneer work. Well, you don't have to. You can enjoy that level of profitability right here, and your goal is 1 hour. You are really targeting the 1 hour mark. I do not want the doctor to have more than 60 minutes treating the patient, and that's a nice number. You'll be in the middle column, you'll be very happy. Now, once you achieve the 1 hour mark, you know what happens? You start to see all of this, the light bulbs all go off, and you recognize, okay, now that I'm at 1, I get it. I can get to 30. Once you get to 1, you can get to 30. Now, the 30 happens pretty quickly. I told you before, after the first few cases, I send it to the patient now. So we do the delivery at home for the non-attachment, non-IPR patients. Delivery at home. The exception I use there is the teenagers. I don't like to send a box of aligners to a teenager. So they come in. So I will deliver the teenager aligners. Mixed dentition teens, they come to the office, we put them in. Even though they don't have attachments in IPR, I want the first one in with the scan in my office. We see it happen, we move on from them. So they get a few extra minutes. All right, that's all I have. I think I'm on time. Woo! Thank you, Dr. Moralia.